Anxiety is a common symptom that occurs in all psychiatric disorders, including depressive illness and most psychosis. Physical diseases like hyperthyroidism, cardiac disease, or hypertension may also present with anxiety and therefore must be excluded. There are various forms of anxiety disorders. For example, generalized anxiety disorders, panic disorders, phobias, obsessive compulsive disorder, acute stress disorder, post traumatic stress disorder, among others. The common ones seen in general practice are generalized anxiety disorders and panic disorders. In all cases of suspected anxiety disorders, it's important to assess the scope of the anxiety, including the antecedents, behavior, and consequences of anxiety for the patient through an in-depth interview. It's also important to ask about the presence of obsessive thoughts and compulsions, as these are increasingly common and tend to be reported out of embarrassment, but which lead to much personal distress. In this case, refer to a psychiatrist. In generalized anxiety disorders, there is excessive anxiety and worrying about events or activities such as performance at school or work, um, occurring on most days for at least 6 months. A panic disorder refers to a pattern of recurrent, unexpected attacks of intense fear or discomfort over a discrete period more than 3 times a week. During attacks, four or more of the symptoms I'll mention develop abruptly and reach a peak within 10 minutes. Panic disorders are accompanied by persistent concern about having another attack or worrying about implications of having an attack. In children, especially, partial complex seizures may mimic panic attacks as in children. Medications are required to treat panic disorders only if the attacks occur frequently enough to cause distress. So the causes of generalized anxiety disorders are multiple negative life experiences, environmental factors, personality traits, genetic predisposition. So the symptoms are excessive anxiety and worry occurring most days for at least 6 months. Anxiety or worry associated with at least three of the following: muscle tension, often reported as pain in various parts like neck, trunk, or headaches. Crawling and burning sensation around the body, restlessness or feeling on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, sleep disturbance, difficulty falling asleep, or frequent weakening and palpitations. So the signs that are usually listed are restlessness, sweating, anxious mood, tachycardia, and tremors. Investigations, none to confirm the diagnosis, attest to exclude probable differential diagnoses such as hyperthyroidism, pheochromocytoma, and cardiac arrhythmias. The main treatment objectives are to reduce anxiety, to attain relief of somatic symptoms. Non-pharmacological treatments, so reassurance about the absence of physical disease once they are ruled out, and teach relaxation methods. Um, Encourage regular physical exercise if possible. Encourage healthy social activities, and cognitive behavior therapy. Pharmacological treatments. For anxiety with somatic complaints, first line treatment, you give sertraline oral in adults 50 milligrams as a single oral evening dose, and then increased by 25 milligrams at 1 week interval if necessary to a maximum of 200 milligrams. In children 12 to 18 years, give 50 milligrams daily, and 6 to 12 years, 25 milligrams daily, and less than 6 years is not recommended. Or you can give fluoxetine oral in adults 10 milligrams daily, and then increase up to 60 milligrams daily if necessary. In children 7 to 18 years, give 10 milligrams daily, then increase to 20 milligrams after 1 to 2 weeks if necessary. Or you can give amitriptyline oral in adults 25 to 50 milligrams daily as a single evening dose. In children more than 12 years, give 10 milligrams daily as a single evening dose with a maximum of 20 milligrams. Can give imipramine oral in adults 25 to 50 milligrams daily as a single evening dose. In children, it's not recommended for this indication. For anxiety with prominent somatic complaints, give propranolol oral in adults 10 to 80 milligrams 12 hourly. Additional treatment for anxiety with significant distress, we give diazepam oral in adults 2 to 5 milligrams 12 hourly for 2 weeks, and gradually tailed off over the next 2 weeks. Do not give for more than 1 month continuously. In children 1 to 12 years, we give 1.25 to 5 milligrams 6 hourly as needed. Referral criteria: refer to a clinical psychologist for cognitive behavior therapy and other non-pharmacological treatment modalities. Refer to a psychiatrist in severe cases not responsive to drug treatment.